Hi, I'm Patrick Hutzel, and you are about to learn secrets that most families of critically ill patients in intensive care will never know. Here, you are about to learn how you can instantly improve your and your family's life if your loved one is critically ill in intensive care, so that you can exercise power, influence decision making, and stay in control of this challenging and difficult situation. Several years ago, when I was a teenager, me and my family lost my uncle at the age of 51 in intensive care. It was absolutely horrific, to say the least. Me and my family are still struggling to this day that we have lost him, and to come to terms with his loss is still hard. He was such a great and lovable guy. I was in hospital myself at the time, having had my tonsils removed. I remember my mother telling me that my uncle had died. It was a big shock. My uncle had cardiomyopathy, a severe weakness of his heart, and he couldn't get a heart transplant. The worst thing for me was that I couldn't even go to his funeral, as I was still in hospital recovering from my tonsillectomy. Shaped by the experience of having lost a close family member in intensive care, I wanted to make a difference in my life, and I went on to become a nurse, which eventually led me to work in intensive care. During the course of becoming a fully qualified nurse, and then during the course of becoming a specialist nurse in intensive care, I had to deal with many critically ill patients and their families, as well as with many end-of-life situations and experiences. And I can tell you that especially in my early days in intensive care, I struggled through each and every situation. I remember vividly my first patient dying in intensive care. He was a 17-year-old teenager who got involved in a severe car accident, and he had multiple rib fractures that ended up damaging his heart, and we resuscitated him in the middle of the night with his parents being present at the bedside when he died. It was my first resuscitation in intensive care, and it wasn't very pleasant. I was mortified, scared, and I struggled with the experience. I can also count numerous other occasions when I looked after patients in intensive care who either ended up disabled or had a limited quality of life to look forward to, and I remember other patients who died in intensive care. One thing that I found those challenging and difficult situations have in common is that generally the support for families of critically ill patients in intensive care is just minimal or not there at all. One question that I kept asking over the years was that if health professionals in intensive care struggle through these difficult and challenging situations, how challenging and difficult must it be for the families who have a critically ill loved one in intensive care? Coming back to my struggles, my difficulties, and my challenges by having lived through the experience as a teenager when losing a close family member in intensive care, as well as dealing with many critically ill patients and their families in intensive care over more than a decade, eventually gave me the strength, the courage, as well as the insights to deal with those challenging, difficult, and often overwhelming situations when somebody is critically ill in intensive care. I found that if I could overcome my own struggles, my own challenges, my own fears, my own frustrations, and my own difficulties when dealing with critically ill patients in intensive care and their families, that I could efficiently help families of critically ill patients in intensive care to overcome their struggles, their challenges, their difficulties, their fears, and their frustrations when their loved one is critically ill in intensive care. Rather than being cynical or feeling helpless, like many health professionals in intensive care do when dealing with critically ill patients and their families, I knew that if I could overcome my own challenges around the work that I'm doing, I could create a structure and a system that helps families to instantly and effectively deal with this massive challenge that life has thrown at them when their loved one is critically ill in intensive care. I saw and I learned things in more than 13 years of intensive care nursing, and I created a system so that you and your family are in control, have real power, and you can influence decision making while your loved one is critically ill in intensive care. The system that I created will help you in any situation while your loved one is in intensive care, whether your loved one is very unstable, whether your loved one is a long-term patient in intensive care, or whether your loved one is approaching his or her end of life in intensive care. No matter how challenging, frustrating or difficult your situation is, with my system I offer solutions to your challenging, difficult and frustrating situation, and with my insights and strategies I help you to deal even with the most challenging of situations. And you will find that if you follow my proven systems, that you can instantly and quickly feel in control, have real power, and you can influence decision making. I'm going to show you what's going on behind the scenes in intensive care that you don't even know, and that you would have never guessed how the things that are going on behind the scenes can impact on your critically ill loved one's treatment and on their care. I'm also going to show you how you can make an instant positive impact on your life and on your critically ill loved one's life while he or she is in intensive care. I'm going to teach you the secret intensive care language, so that no matter how much you know about intensive care now, you will be seen as an insider by the doctors and the nurses looking after your critically ill loved one in intensive care. You will also learn how to effectively and quickly position yourself in meetings or negotiations with the intensive care team, so that you are in control, you have real power, and so that you can influence decision making. I will also show you how to position and prepare yourself mentally, so that you are mentally strong and you are mentally well prepared, so that you can deal with whatever this difficult situation is throwing at you. With this knowledge, you will be prepared for any situation and any challenge that you, your family and your critically ill loved one are in. I'm going to show you how doctors and nurses view the situation that you, your family and your critically ill loved one are in, and how their view is different from your and your family's view. I'm also going to show you how you can successfully bridge those differing views and turn the tables, even though you are not a doctor or a nurse and you don't have intensive care insider knowledge. I'm going to show you why some doctors and nurses in intensive care don't want you to have control, exercise power, and they often don't want you to influence decision making. I'm also going to show you that despite the perceived power that doctors and nurses have in intensive care, how you can quickly and instantly turn the situation around. I'm also going to show you what mistakes that you are making during the time that your loved one is critically ill in intensive care. You are most likely unaware that you are making those mistakes, which I see families of critically ill patients in intensive care are making over and over again, and it holds them back from having control, power and influence decision making. I'm going to show you what you and your family need to do if your critically ill loved one is very unstable in intensive care and you don't know whether your critically ill loved one is going to survive, or if your loved one is a long-term patient in intensive care, or if your loved one is approaching his or her end of life. I'm also going to show you what you and your family need to do in detail, so that you can stay in control, have real power, and how you can influence decision making. I'll also teach you what you need to know about the culture in an intensive care unit and how it might impact on your critically ill loved one's care and treatment. So just enter your email below and come inside, and you'll get your free instant impact report that'll teach you immediately how you can take control, have real power and influence decision making, no matter how challenged, frustrated or vulnerable you, your family and your critically ill loved one in intensive care feel. In my free instant impact report, you will discover how to ask the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability. I'll give you 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You'll get behind the scenes insight so that you understand what is really happening. You learn how to change your thinking and your behavior that might hold you and your family back to have more control, more power and more influence whilst your loved one is critically ill in intensive care. I'll show you how you can control your emotions, how you need to manage the doctors and nurses in intensive care, and it's not what you think. I'll show you how to speak the secret intensive care language so that doctors and nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. I'll show you how to deal with critical situations and end-of-life situations. And I'll show you how you need to manage the rest of your family. So enter your name and email address below and take the first step in how to take control, how to have real power, and how you can influence decision making while your loved one is critically ill in intensive care.